Good morning, Ms. Hickman. My name is Alexandria Westcar. I'm a student here at the University of South Florida's Department for Communication Sciences. I appreciate you coming to meet me this afternoon. How are you?
I'm doing pretty good. How are you?
I'm good. Thanks for asking. Basically, this interview is part of my project required for my Adult Communication Disorders class. And I'm actually going to be talking to you about your symptoms, the result of your accident, and how speech therapy can benefit you in the future.
Okay.
All right. Now, as a student, I am learning how to interview, ask questions, and document information. It would be really helpful, if I could have our conversation on tape so I can analyze, review, and just go over our conversation. So I would like your permission to audio record our conversation.
That's fine with me. I don't mind if we record, but I'd rather not be in the video. That's just my personal preference, if you don't mind.
Okay, that's perfectly fine. I'll go ahead and make note of that here.
Okay.
All right, now let's get started. When was your accident?
Let me see. It was July 22nd, 2011, so that was almost 3 years ago.
Yeah, about that. And what changes have you noticed in your speech since the incident? Any slow speech or having trouble getting the words out, things like that?
Yes. When speaking, sometimes I stutter and there's pauses, or I take a long time to respond. And then when I do respond, sometimes my family tells me that I'm off topic, or they're confused about what I just said. And also, I think my main problem, too, is that I have a lot of concentration issues.
Okay. All right, I'll go ahead and get that noted here. And how has aphasia affected your daily life, like with your activities and relationships, etc.?
I've been really depressed about it. It's hard for me to communicate with others and express my thoughts and feelings. And the thing is, I used to be really social. I loved going out and everything, but now I just stay at home because it's less stressful.
Okay. All right. And you did mention you were depressed. How have you been dealing with your depression? Are you on any medications or seeing a psychologist for that?
Yes, I do take an antidepressant, but I'm going to have to talk to my doctor about that because it's been making me hallucinate.
Okay.
And things like that, and that's a little scary for me to have these. And then, let's see what else. I try to talk to people about it because I know it's not good to keep things bottled up. And also, I see a therapist about, to talk about the emotional things that I'm dealing with, adjusting to this.
All right. You made a good point of not, bottling things up. And have you had any previous speech therapy or any type of treatment at all?
No, I haven't seen a speech therapist, but I have seen a physical therapist. I've seen a neurologist, a psychiatrist, an ear, nose, and throat doctor, and a lot more specialists. I can't really remember all of the things that we worked on after the accident, but because it's such a blur to me now, it all blends together. But one thing I do recall is working on my balance and physical therapy, and then just, taking a lot of tests.
Okay. All right. And I know you mentioned a couple of doctors. Did you find the procedures that they went through, their testing, did you find any of that helpful to you?
I did. The physical therapist and the ear, nose, and throat doctor, they helped a lot because I experienced so much vertigo it just made me so nauseous. I used to throw up daily, and I also had trouble with tinnitus, and I still experience those, but not as often.
Okay, so the ENT definitely helped with some of those symptoms. All right, I'm pretty happy that helped for you. What medications are you currently taking, if any?
Oh my gosh, your blouse is so nice.
Oh, thank you. I actually got it at TJ Maxx.
But what were you saying? I'm sorry.
Oh, I was speaking about your medications, if you're on any for some of the symptoms that you have.
I can't recall all of them to be honest, but afterwards I'll just give you a list that I have
Okay.
listing my medications.
All right, that'll be great. Thank you. And Ms. Hickman, are you currently working or going to school?
Neither actually, but returning to work is one of my main goals. I'm not used to not working or being out of school. So I want to eventually be able to go back and be a nurse.
Oh, wow, nursing, that's a really great field. I'm glad you have that goal there. And I see you did mention stuff about going to school and going back to work. What are the goals that you feel that speech therapy can help you achieve?
I feel like speech therapy can help me a lot, although I have made substantial progress since when the accident first occurred 3 years ago. But I feel like speech therapy can help me go the rest of the way, make the rest of the progress that I need in order to go back to school and also work, because right now I know there's no way that I'm going to be able to concentrate and focus long enough to do these tasks. So I just really think that speech therapy can help me with these things, just all of the aspects of speech that go into speech that, will help me be successful.
All right, that sounds good. I'm glad you're differentiating and setting, a good pace for yourself. How has your speech communication difficulties affected your family members or people you have personal relationships with?
Well, now it's much better, but I felt like they just really felt really bad for me, especially because of my age. They feel like I'm just too young to have all of these physical and mental medical issues, having to take all of these medications, going to doctor's appointments. It's just so much for a young person to deal with. But I like that they are very patient with me. They never get frustrated with me. They always help me in any way that I need. My mom and my sister, they're always, taking time out of their schedule to take me to my doctor's appointments and things like that. Like, I'm just really thankful for them, because I need them in my everyday life. It's just like, I'm 23, but I still live at home with my mom. Like, I could never live on my own. So, I just really depend on them.
All right.
Now,
that sounds very good. I'm glad to hear that your family is very supportive with you going through these troubles with your health. Can you tell me of a time when you felt embarrassed about your speech difficulties, maybe in public, or you couldn't get your message across, or maybe just speaking with someone who didn't know about your accident?
Right. Well, let me see. There has been a couple of times when I was embarrassed. One time I was at the store, and I was trying to ask the salesman there a question. And in my mind, I knew exactly what I wanted to ask, but I just couldn't, I couldn't say what I wanted to say. And that just was so embarrassing. And I feel like that's why I have some anxiety with speaking to people, because of that experience and others like it.
All right. And any other incidents? I know you mentioned the store. Anything else?
Well, with my family, I'm not really embarrassed because they understand, but it's just sometimes being around my friends, they don't understand what I'm going through.
Definitely.
They don't know anyone with a TBI. So it's just, just general embarrassment of having to tell people what happened.
Thank you for sharing that with me. That was very helpful.
No problem.
And, well, I think that's all the questions that I have for today. Did you have any questions for me or anything about this project that concerns you or anything like that?
No, not really.
All right. Well, Ms. Hickman, this has been very helpful and very informational to me and my classmates. I'm sure this will help us, figure out how you can benefit from speech therapy. Also create a treatment plan for you, for our project. It was a pleasure meeting you, and you have a wonderful day and afternoon. Bye-bye.
Thank you. I'll see you soon.
Okay, great.
Bye-bye.